Welcome to the shoulder complex lecture, part one. The shoulder is quite complex, and so we will be having certainly more than one part. Now, the parts that the shoulder complex is made up of are the clavicle bones, the scapula bones, and the humerus. So you can see the clavicle bones here sitting on the anterior portion of the body in front of the rib cage and butting up against the sternum. Then they come out and across and connect with the scapula bones, which live on the back of the rib cage, and some people might say the back. And then we have the humerus bones, and the humerus articulates with the scapula here. And so the joints involved in the shoulder complex are the sternoclavicular joint, where the clavicle bone connects to the sternum, the acromioclavicular joint, that is where the acromion process of the scapula connects with the clavicle. And then we have the glenohumeral joint, which we're talking about primarily today. That's where the humerus sits in the glenoid fossa of the scapula. And then we have a joint which is not really a joint, the scapulothoracic joint, where the scapula articulates with the rib cage. And the reason why I say it's not really a joint is that there's no bone-to-bone connection there with the scapula to the rib cage. The scapula floats on top of the rib cage and it moves over it, but it does not connect directly to it. Here are those joints again that we just reviewed. They are simply labeled here for your convenience for a study slide. And now we'll be diving into the shoulder joint, specifically the glenohumeral joint. So again, this joint is made up of the humerus and the scapula. Particularly, it is the head of the humerus and the glenoid fossa of the scapula. And so as you can see, this makes a ball and socket joint. And as you may remember from earlier in the semester, ball and socket joints are a type of synovial joint. So this is a synovial joint. And it has all of the ranges of motion that every ball and socket joint come with. And so this joint can do flexion, extension, abduction, adduction. And when it can do all of those movements, it can do circumduction. And it can also perform external or lateral rotation and internal, otherwise known as medial rotation. Here are some of the bony landmarks of the scapula. And please do note that this is an anterior view of a right scapula. So imagine that we are looking at someone head on. We're looking at the anterior portion, our anterior view of their body. And if they were just a skeleton, we would be looking through the rib cage at this scapula. So bony landmarks here for this slideshow. All you really need to know, well, no, you need to know some more. Primarily, you need to know this glenoid cavity, okay, and the subscapular fossa, and that this is the lateral border of the scapula. And I believe that's all that you really primarily need to know for this slideshow today, but I would like you to know all of these bony landmarks. So do please note the superior and inferior angles, the medial border, which sits closest to the spine, and the superior notch you don't really need to know. but you may memorize it if you would like. And we have this coracoid process that kind of looks like a finger that sticks out towards the anterior portion of the body. And there's a number of muscles that attach on here. Anything that's, sticking out on a bone, there's probably muscles that attach to it. And then we have the acromion process, as mentioned earlier, because this articulates with the clavicle bone, the AC joint, we call it for short, that acromioclavicular joint. Above and below the glenoid cavity, also known as the glenoid fossa, are the supraglenoid tubercle and the infraglenoid tubercle. Okay, this is where at the top our biceps brachii will attach there, the long head, and then down below we have an attachment point of the triceps. So they straddle that socket. All right, let's look at the posterior view. So from the posterior view, we can also see the superior and inferior angle. Again, the lateral border will be important for us in today's lecture. And then the infraspinous fossa is something to know for today. We'll be looking at a muscle that attaches here and also over on the edge of the infraspinous fossa up against the lateral border. And there are some muscles that attach there as well. Okay, then we have the spine of the scapula. And then above the spine of the scapula, we have the supraspinous fossa. And this is where one of our muscles also attaches that we'll be looking at today. All right. So now we're looking at the humerus from an anterior view. And so the humerus landmarks you will need to know right now are the greater tubercle, and this pokey bump up on the top lateral edge of this humerus. And that might make you think about the greater trochanter, right? We have this greater tubercle, much like we have a greater trochanter in the femur. And then we have a lesser tubercle, kind of like we have a lesser trochanter of the femur. Then we also have the head of the humerus. And the head of the humerus, as we saw earlier, sticks into the glenoid fossa of the scapula. And then in between the greater tubercle and the lesser tubercle, we have the intertubercular groove. All right, and then as we follow that groove down, we'll notice that laterally we have the greater crest, the greater crest and the crest of the greater tubercle. And more medially, we have the crest of the lesser tubercle. All right, then if we keep coming down, we won't need to know this for today, but eventually we'll need to know about the deltoid tuberosity. And then down at the distal end of the humerus, again, we won't be going over these in this lecture, but you will be needing to know these sooner than later. And a lot of these landmarks might remind you again of the femur. So there's condyles on each side, and there's supracondyles, or supracondylar ridge over here. Okay, and supracondylar ridge on the other side. Okay, but let's go ahead and move on from there so we don't get too stuck in there. We'll be looking at that later on as we look closer at the elbow joint. All right, here's the posterior view. So from the posterior view, we can only see the greater tubercle. We can't see the lesser tubercle, but we can see the head of the humerus. And now in this slide, we see the joint capsule. So remember how synovial joints all have a joint capsule. So here is that joint capsule or articular capsule. And then to note is just how little space there is here. We can already see that without even muscles attached, we have all of these bones, and now we have some ligaments coming into play, connecting the bones to one another. And then we have some muscles that are cut away here. So I guess we do have some muscles kind of, but they're, out of the way. And so there's a lot of stuff going on. And that's the primary purpose of showing you this slide, is to start understanding how um, the shoulder is quite complex and there's a lot going on there. And so that also unfortunately means that a lot can also go wrong. And it's an area of the body that is commonly injured. All right, so on that topic, why is it so commonly injured? Okay, well, there's a lot going on. There's very little space in between the bones. And then also there's a very shallow socket. And so look at the glenohumeral joint compared to the acetabulofemoral joint. Okay, this is a much deeper socket. And there are a lot of ligaments in both the hip as well as in the shoulder. But the ligaments are more lax in the shoulder, and they're a lot stronger and tougher in the hip joint. So they both allow for large ranges of motion, but the shoulder joint is much less stable. And I'm going to go ahead and pull out of the screen share. Hello. And show you some of the bones that I have here in my studio. So here we have a scapula. Let's try to get some better lighting for you. All right, and the humerus. All right, so notice how the head of the humerus could really quite easily just slip and fall out of that socket. It's very shallow. All right, so those ligaments are super important for keeping it right in the center of the socket, as well as the muscles. And we can see that between the head of the humerus and this acromion process, there's not very much room in there. All right, and there's a lot of stuff that lives in there. Now, this is the posterior view. Let's look at the anterior view. In the anterior view, okay, and let's look at the superior view for a moment. Here is that coracoid process, and there's not very much room in there either. And there's a bunch of stuff that flows down through and in between. So if the head of the humerus gets pulled forward at all, it can easily get in a pinch. There's a muscle we'll be looking at today that helps to hold the humerus in the socket so it doesn't fall out, but if it gets tight, it can pull that head of the humerus up. All right, and then we have muscles again that attach onto the coracoid process that can pull the shoulder forward. So, oh no, we don't want to go too high up. We don't want to go too far forward. So we need to make sure that that head of the humerus stays in the center of the socket. Okay, and we'll talk more about that throughout the lecture today. All right, moving on. Here is a picture of a lot more of those ligaments that I was talking about. Now, I'm not going to have you memorize all of these ligaments. You're welcome. But I do want you to take a gander so that you understand how much is going on in there. Oh, I just remembered I forgot to show you another model. Let me go ahead and share this with you. All right. So here's another model I have of the shoulder joint with many of the ligaments built on. So from above here, we can see the clavicle bone is attached here onto the scapula. And there's ligament holding those two together, making up that acromioclavicular joint. All right, we have ligaments attaching the head of the humerus onto the scapula from numerous angles. And so now look, that space is getting smaller. Oh, there's even less room, and we don't even have the muscles on here, or blood vessels, arteries, nerves. Yeah. Okay. So what we also don't have on there are the bursa. So there's also bursa in there, cushioning the joints and cushioning the spaces between the ligaments and muscles. And so there's a lot going on in there. And if there's inflammation in the bursa, then that's going to press up against everything else. That can then press into the nerves and the blood blood flow, the arteries, veins. So it is easy to get into a pinch in the shoulder joint. So common shoulder injuries, as I was just mentioning, it's easy to get into a pinch. So rotator cuff impingement syndrome is quite common, and we can just follow this arrow down and over here to the bottom left-hand side of the screen. We can see now this supraspinatus tendon. So the supraspinatus or supraspinatus, okay, tomato, tomato, it travels underneath that acromioclavicular joint, and it comes around and attaches onto that greater tubercle. And so and this is a muscle that helps to hold the head of the humerus in the socket. And like I mentioned earlier, if it's tight and it pulls the head of the humerus upwards, then can get into a pinch quite easily. Rotator cuff tears are also very common, and this supraspinatus is the most common rotator cuff muscle to get torn. All right, so today we will be looking at the rotator cuff muscles of the shoulder joint. Then subluxations and dislocations. So a dislocation is the whole head of the humerus detaching and sliding all the way out of the socket. And subluxation is when it's just slightly slid out or down, out to the side, or pulled upwards or slid downwards, okay? Somewhere where it's not quite in the center of the socket where it should be. You might be familiar with that term, subluxation, if you've ever seen a chiropractor. Okay, they're often talking about the vertebrae being slightly out of place, the joints not quite being, stuck together the right way. Then labral tears. So just like the hip joint, the acetabulo-femoral joint, the shoulder joint, the glenohumeral joint, also has a labrum, and that deepens the socket, and that labrum can get torn. Oftentimes it's from an overhead type of sport. Could be like a baseball pitcher or a tennis player or something like that, who is engaging in activities where there's high velocity and a large range of motion going on in the shoulder joint. So here's a reminder of our shoulder joint movements. Now remember these are not scapula movements. We're really wanting to think about the humerus, that head of the humerus in the socket of the scapula. So we have our shoulder flexion, shoulder extension, abduction, and adduction. And I have these yellow arrows here because these are the movements that the muscles that we're looking at today partake in. All right, then we have our horizontal adduction and horizontal abduction, which some of the muscles that we will be looking at, they help with these too. I just didn't highlight them, right, because they also go kind of hand in hand with medial rotation and lateral rotation. So horizontal adduction, as you come across, really those medial rotators are also engaging to help steady the shoulder joint in the socket there. And then the lateral rotation is paired with horizontal abduction. So there's some of that going on at the same time. Okay, so here we will dive into the rotator cuff muscles. And these are the deepest muscles of the glenohumeral joint. They're kind of like the core of the shoulder, if you will, or the inner unit. And there are 4 muscles in the rotator cuff. The acronym that we often use to help us remember these muscles is SITS: supraspinatus, infraspinatus, teres minor, and subscapularis. So we can see all of these muscles over here. Supra, meaning above, right? We have the supraspinatus above. Infra, meaning below. So that's over on the posterior aspect of the scapula, lives the infraspinatus. Remember that infraspinous fossa? Okay, that's where it lives. Then we have the teres minor. The teres minor is also located on the posterior and lateral border of the scapula. And now on the left-hand side over here in this picture, we're looking at an anterior view. And so this is the subscapular fossa. And the subscapularis muscle attaches onto the subscapular fossa. All right. So the first muscle that we will look at in detail is the supraspinatus, sometimes called supraspinatus. Okay, this muscle lives in that supraspinous fossa up above the spine of the scapula. And then it comes down underneath, as you saw a picture of earlier, underneath the acromioclavicular joint. And then it attaches onto that greater tubercle of the humerus. So we can see shaded over here and in red over here, where that muscle trajectory lies. And then we can see on the picture above, a picture of that supraspinatus muscle. So the action is abduction. You might be able to just already kind of tell that it would swing that humerus up out to the side. And then it also helps to hold the head of the humerus up in the socket, as I mentioned. So this, again, as I mentioned earlier, is the most often injured rotator cuff muscle. And to strengthen this muscle, there is an exercise called the full can exercise. So let's go ahead and do that together. Okay, so to get this muscle to engage the best, kinesiologists have found, I'll just grab a weight here, okay, that, actually I'll go ahead and grab two, might as well be as symmetrical as possible. All right, okay, so kinesiologists have found that the supraspinatus muscle, it will be active if we go straight up out to the side, like if I'm just moving on that frontal plane. Okay, it will be engaged some when I lift my arms up kind of anywhere around that range. But if I bring my arms more out to a 45-degree angle, yeah, not straight out to the side, not straight forward, this angle, which we often also call scaption, this is the best angle to get the supraspinatus engaging and strengthened. Okay, so from the side here, I'm going slightly forward as I lift up. Now, that muscle really is only effective up to, I don't know, I've heard different degrees, but maybe about 45 degrees or so. And then there's other larger muscles like our deltoid muscles that do more of the work then on the rest of the way up. And then on the way up, of course, then the supraspinatus, that can only lift us to here, okay? It doesn't lift the scapula any higher. And so there's really no point in going any higher than shoulder level when we are focusing on strengthening that supraspinatus muscle. So as this muscle is commonly injured, it is very important to strengthen this muscle, especially for athletes that are in high velocity sports. A lot of our racket type sports and overhead throwing sports. Next up, we have the infraspinatus. So from above down to below. So the infraspinatus, and it lives on the infraspinous fossa, I almost said process, the infraspinous fossa of the scapula, which is down below the spine of the scapula. And then it comes laterally to the side, and it attaches onto the greater tubercle of the humerus a little more inferiorly and posteriorly compared to the supraspinatus. And the action or actions of this muscle are lateral rotation, so external rotation of the shoulder, adduction of the shoulder, and again, it is a stabilizer. All of these rotator cuff muscles help to stabilize the head of the humerus in the socket. So this muscle particularly helps to hold the humerus more posteriorly in the socket. And remember, anteriorly, we have that coracoid process kind of in the way, and superiorly, we have the acromion process. So this posterior muscle is really important and a key muscle in holding the head of the humerus properly in its position in the socket. And it is the most powerful external rotator muscle of the shoulder complex. So it's very important to have this one nice and strong. And it is also the second most injured rotator cuff muscle. And so especially as we work on strengthening the rotator cuff, we want that supraspinatus strong and we want this infraspinatus strong. Okay, maybe that'll help you to remember. Yeah, the spinatus muscles, we want them nice and strong. And it is an important decelerator in high velocity internal rotation activities. So it is going to be concentrically working as she externally rotates, this tennis player pictured down below. Okay, it'll be concentrically contracting there to kind of preset and preload the shoulder. And then the internal rotators, they're going to engage for sure concentrically as the tennis racket gets propelled forward to hit the ball. Then as the arm continues and we decelerate the arm, as the arm continues and we decelerate the arm, the infraspinatus muscle, whoops, the infraspinatus muscle is responsible for slowing that arm down. So that deceleration, that'll be an eccentric contraction of the infraspinatus to control that. So if the infraspinatus is not strong eccentrically, then we can have shoulder problems. Next up, we have the teres minor. The teres minor is good friends with the infraspinatus because it has the same actions. Okay, it's always nice when we can memorize two muscles together, kind of lump those two together. So they're both lateral rotators, also known as external rotators, and they are both adductors, and they both stabilize the head of the humerus and the glenoid cavity. Again, pulling it more towards the posterior aspect of the glenoid fossa or glenoid cavity. All right, so we can see that this muscle attaches over here on the lateral border of the scapula, and then it comes laterally out to that greater tubercle of the humerus, more posteriorly and inferiorly than the attachment point of the infraspinatus. So as we look at these attachment points here, and we look at the origins over here, okay, you might envision a hand, like this is the palm of the hand, and then the fingers are coming out and holding onto the head of this humerus to hold it into the socket. We have a picture of that toward the latter end of the slideshow, as you will see, but just try to stick that idea already in your mind right now. All right, and then we have the subscapularis muscle. So this muscle, we're looking at the body from an anterior view. And so the subscapular fossa, this is what sits up against the rib cage. And so then the subscapularis attaches to the subscapular fossa. So those names of the bones can often help us to learn the names of the muscles, right? And then this one moves out again laterally, but this one attaches onto the anterior portion of the humerus. It attaches onto the lesser tubercle of the humerus. And so then would it make sense to you, if you just think about it without even looking over those actions, how it's going to spin this humerus bone inward, medial rotation. Okay, now this muscle does have other actions. I'm not going to have you memorize them, but I just want to point out again that the Trail Guide to the Body simplifies things a bit, which is why I have you looking into that book as well. But it doesn't go into a lot of the details of these muscles and the structures of the body that I want you to know, and the mechanical pieces. So I've just put a note down below here that this muscle does do some other actions, and the actions that it does are the same actions as the latissimus dorsi and teres major muscles. The teres major also lives on the scapula and attaches to the humerus, which we will see in another slideshow. It's a quite small muscle like the teres minor, not to be confused with the teres minor, because the teres minor is an external or lateral rotator, whereas the teres major is an internal rotator, along with the latissimus dorsi. And so all three of those muscles, the latissimus dorsi, the teres major, and the subscapularis, they are all good friends, okay? And the actions that they all do together are medial rotation, adduction, and extension of the shoulder joint. So they do this. Okay, do you know any sports that do that, right? Like the butterfly stroke. Okay, so we have that medial rotation, adduction, and extension. You might be able to think of other things too. There's a lot of sports that need those muscles to be strong. If they are very strong, however, that can sometimes, if we don't counter it, lead to tightness, which then leads to them not being quite as strong down the road if the whole shoulder complex is not working well. But you might think of, if you're familiar, for instance, with Michael Phelps, the swimmer, he's got this, kind of going on, this posture from the side. See a little more, okay? Those internally rotated shoulders. And so you want to keep those muscles nice and strong, but we also want to counter that and keep them nice and flexible and work into those oppositional muscles of the infraspinatus, no, I'm switching it up, and the teres minor. Okay, so always trying to find balance in our bodies. So the subscapularis or subscapularis tendon, we can see here, it lives underneath this coracoid process on the anterior side of the scapula. Again, it is situated on the anterior portion of the scapula, which sits against the rib cage. And so to remember where this muscle lives, I often think of submarine because it's hidden underneath these bones of the posterior aspect of the scapula and then these ribs here. And so it's underneath the surface. We can't see it. It's very difficult to be able to palpate it if you are a massage therapist, or just trying to notice if it is activating or not. So maybe that will help you to remember this muscle, the submarine muscle, subscapularis. Now, Remember earlier I was talking about how these muscles are kind of like a hand that's holding the head of the humerus up into the socket. So here is a picture from the Trail Guide to the Body, which I just love. I think it's very useful. And you might even, I don't know, maybe write on your fingernails with a ballpoint pen or something to help you remember from posterior to anterior which muscle attaches where. So we have the teres minor, the infraspinatus, the supraspinatus, and the subscapularis. So it would be TIS, okay? And then that supraspinatus tendon is just pictured here down below again. And we are reminded that it lives underneath this acromion process and how easy it is to get into a pinch there. So that is the most commonly injured muscle of the rotator cuff. And here's the superior view. So we can think again about those fingers, each of these as individual fingers coming down and around and attaching onto the head of the humerus to help it stay sucked up into the socket. So to keep these muscles healthy, we can massage those muscles out so they don't gather up fascial adhesions, they don't get sticky and stuck together. We want them all working as individuals and working together as a team. And so here's a ball. You could use a lacrosse ball, you could use a pinky ball, a tennis ball. And so the ball is placed on the lateral border of the scapula. The arm is held out to the side, and you might even swing this elbow forward to open up the back of the shoulder more to get into the muscle. You can also roll directly on the posterior side of the scapula, below the spine of the scapula. You can access that infraspinatus muscle. All right, then shoulder joint mobility exercises you can use for warm-ups. All right, maybe once you've done a little self-myofascial release, this is just a good progression that I've made to share with you of keeping to keep the shoulders nice and healthy. So there's some shoulder rolls there, some arm circles to get those rotator cuff muscles activated more so, and some arm swings, crossing the body and swinging the arms out to the side, getting that horizontal adduction and abduction going on. All right, so just rolling around. There's other muscles that we're more warming up when we do shoulder rolls. The rotator cuff is not doing so much unless we consciously add them into the mix. So I'm going to stand up to share that with you. How you could do that. All right, so you might internally rotate as the shoulders go forward and up, and then externally rotate as you go back and down. So that'll add more rotator cuff into the mix. And then of course, we also want to reverse it, going back with external rotation and forward with internal rotation and down. All right, so that'll get those rotator cuff muscles starting to warm up. And you can also add fingertips to shoulders, do shoulder rolls here and reverse, and you can go into big arm circles. And then we can more dynamically, all right, go there. And then we have those arm swings. Right, you can simply just cross and open, and I usually reverse which arm is on top. I'm going to add some spine into the mix. You might side bend, or you might cross and then pull the elbows back and cross and open, cross and pull, cross and open. And just keep changing which arm is on the top. So that's going to warm up a lot more than just the rotator cuff, but it'll do a good job at warming up the rotator cuff as well. And we really want the whole shoulder complex to be nice and warm when we are moving into an upper body workout. Okay. Next up, we have strengthening exercises for the rotator cuff. So factors to consider here are that these muscles are very small relative to the other, larger, more exterior muscles of the shoulder. Shoulders like the deltoids, the latissimus dorsi, the rhomboids. not super huge, but maybe a little bigger. And the trapezius muscle. All right. So these are small muscles. So we're going to do lower weight to challenge them and a higher number of reps because we don't want to overdo it. We don't want to tear these muscles. But they also are, we might say, functional muscles, or they're used in many different activities. And so they have a mix of fibers. They have both slow twitch and fast twitch muscle fibers in them. And we want to be able to challenge both of those. But usually we start more with those slow twitch, more endurance muscle fibers, and then work our way up in our workouts, from more simple exercises to complex, as well as from easier exercises, less weight, to more weight, to and also speed, right? So working our way up to agility and power. So we're not going to be working on speed or a lot of weight here. So again, remembering that we're using really light weight. This woman here is using a soup can. And so using something that's just like 1 to 3 pounds, I usually say 3 pounds max. Certainly there are people that can work their way up to a bit heavier than that. But again, these are small muscles that can tear and are commonly torn. So want to start people out with light weight and work our way up from there and not go too heavy. Some people also need to start without any weight and just work on the motion using just body weight. Okay, and then we have a band up over here representing different ways that we can strengthen this muscle, particularly the subscapularis, which is that internal rotator muscle, medial rotation. Okay, so we're going to have to be holding the soup can in the bottom arm and lifting it up and down from there. So this is the down phase, this is the up phase. So the up phase is going to be concentric, the down phase is going to be an eccentric contraction of the subscapularis. Now over here, well, let's actually come back to our main picture in the center here. All right, so even if she wasn't holding onto the soup can, she'd be lifting up that arm, moving it into medial rotation against gravity, right? Gravity would make her externally rotate. And so it's the internal rotators, or the also known as medial rotators, that are going to concentrically contract to lift her up. And then they will eccentrically contract to lower the arm down, whether she's holding onto a soup can or not. Now over here, if he wasn't holding on to a cable, the external rotator cuff muscles, the ones that externally rotate, the teres minor, the infraspinatus, they would rotate the arm out to the side. And then the internal rotator cuff muscle, the subscapularis would move the arm in, because the arm is just hanging straight up and down from gravity. So it's just really internal force from those muscles, us consciously making the arm externally rotate and internally rotate. Gravity isn't making us do that. Gravity is just making the arm drop straight down. Okay, then when we add on resistance from the outside, then we're pulling against that resistance with the internal rotator cuff muscle. The subscapularis is doing the work. And then it has to slow down the cable. Okay, so we don't just slam the cable back and let the cable take over. Okay, the force from the cable. If we want to control the arm back open, okay, so this is, let's say, phase 1 and this is phase 2. So phase 1, crossing the arm over, is a concentric contraction. Then phase 2, to let the arm back out to the side, that's still the subscapularis working. It's working eccentrically as the arm externally rotates. So it's not the external rotator cuff muscles that are doing the work to externally rotate the shoulder on external rotation in this particular exercise. So you really need to know where the force is coming from to understand the phase, to understand the agonists and to understand what contraction type is going on in each phase of the movement. All right. So here we have the opposite. We have the infraspinatus and teres minor. And these are our external rotators or lateral rotators. So here's our down phase or our starting phase, and then our up phase. And she could even bring that can higher up above the waistline if she has enough external rotation available in the shoulder joint. So lifting and lowering. So lifting would be concentric and lowering is eccentric. Here we have the supraspinatus. And so I showed you the full can exercise earlier. So here's doing something similar to that. He has the palm facing inwards. So if he actually went thumbs up, it would be a little more effective, but this will still be effective. It's strengthening the supraspinatus muscle. And here are some adduction exercises. So remember the infraspinatus and the teres minor are also responsible for adduction of the shoulder. So here's adduction at a number of angles. So you can have a TheraBand, for instance, around a doorknob and pull that arm down towards your hip, or you can pull it across the body. And there's just multiple angles that you could go all the way up into that horizontal adduction. Now, to strengthen the rotator cuff muscles, they're responsible again for keeping the head of the humerus stable in the socket. And so help to navigate the head of the humerus and keep it where it belongs in all kinds of different exercises. And so working on shoulder stability exercises, both isometric exercises and also more dynamic exercises, are going to work the rotator cuff. So here we have some various planks to challenge all of the different muscles within the rotator cuff. And then we also need to think about how we can challenge and prepare our athletes for the demands that are going to be placed on their rotator cuff muscles. So especially those athletes that are in high velocity sports, we want to avoid tears of the rotator cuff and remembering those commonly torn rotator cuff muscles or damaged rotator cuff muscles are the supraspinatus and the infraspinatus. So we need those ready for these high velocity sports. So once we have done our self-myofascial release and we've done our warm up and we've activated those rotator cuff muscles, strengthen them with our light weight, okay? And then we work our way up towards more power and agility. So we're prepared for these types of sports. So I've included this YouTube video in this week's content page. So please take a look at it after you watch this lecture, and you will learn a whole bunch of fabulous dynamic exercises to be able to strengthen and prepare the shoulder for those types of high velocity sports. And really, they're great for anybody. Once we've strengthened our rotator cuff muscles, we also want them to be flexible. So here are some shoulder stretches. And in this top pose, this yoga pose that we call Gomukhasana or cow face pose, all right, both shoulders are stretching the rotator cuff muscles, but they're stretching different ones. So this is a really great, efficient pose to get a lot of stretching in of all of those rotator cuff muscles. So the arm that is up overhead, we are stretching the subscapularis muscle. Remember, that's an internal rotator. And so this is in an externally rotated position, in this overhead arm. And then on the left, we have the supraspinatus muscle, which is being stretched downward. And then the infraspinatus and the teres minor, remember, those are both external rotators. And so this shoulder joint is being put in internal rotation or medial rotation to stretch those external or lateral rotators. Okay, and then same down below here, this stretch is going to be lengthening the infraspinatus and the teres minor. Then over on the bottom right, this exercise or this stretch is externally rotating the shoulder. So again, it's going to stretch the internal rotator cuff muscle, the subscapularis. And this is a great stretch. So this person is standing through a doorway. The foot is through the doorway in the front, and then try to push the hips and the chest through while the forearms are up against the door frame. Now these variations with the elbows down low and higher up, that's going to also help stretch out the pectoralis major and the pectoralis minor muscles. So it's multi-beneficial. And then last, in a rotator cuff focused workout, rest and recovery is a nice way to finish up, lying on a foam roller and going into external rotation here in a goalpost-like position, or even the arms stretched straight out or up in a Y. That'll help to stretch open the front of the chest, which is usually the tightest part of the shoulder. So usually it's that subscapularis muscle that is tight, along with the latissimus dorsi and the teres major, which I mentioned earlier. And then also the pectoralis major, the pectoralis minor, and the anterior deltoids. So we'll look at those other muscles later on. This is a lovely way to finish up a full comprehensive shoulder program.